Is chronic bronchitis a part of COPD? Imagine breathing through a straw every time you try to take a deep breath. That's what living with some forms of lung problems can feel like. Today, we're exploring a common question. Is chronic bronchitis part of chronic obstructive pulmonary disease? Chronic bronchitis is a specific condition where the airways in your lungs produce too much mucus. This leads to a persistent cough that lasts for at least 3 months, and it happens over 2 years in a row. It's a common problem, especially among smokers or those exposed to lung irritants. Now, when this mucus buildup causes ongoing airflow issues, it becomes part of a bigger condition called chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a broad term for lung diseases that block airflow and make breathing difficult. It includes 2 main types: chronic bronchitis and emphysema. Chronic bronchitis is recognized as a subtype of COPD because it shares many features with the broader disease. In fact, about 85% of people diagnosed with COPD have the chronic bronchitis form. In chronic bronchitis, the cells that line your airways produce too much mucus. This excess mucus clogs small airways and causes inflammation, which worsens airflow problems. This leads to symptoms like a chronic cough, lots of sputum or phlegm, and shortness of breath. When these symptoms are combined with airflow obstruction measured by lung function tests, doctors classify it as COPD. Having chronic bronchitis as part of COPD also means there are increased risks. People with this condition tend to have more frequent flare-ups or exacerbations. These episodes can make breathing even harder and speed up lung function decline. They are also more prone to lung infections and other complications like high blood pressure in the lungs, which can strain the heart. It's important to understand that COPD isn't just one disease. It's a collection of conditions, and chronic bronchitis is a key part of that collection. While emphysema mainly destroys lung tissue and causes breathlessness, chronic bronchitis is more about mucus and airway inflammation. Both contribute to the overall picture of COPD, but chronic bronchitis is often the more noticeable because of the cough and mucus production. Knowing that chronic bronchitis is a component of COPD helps doctors decide on the best treatment. For example, medications that reduce mucus or inflammation can be especially helpful for those with the bronchitis type. Recognizing this subtype also helps predict how the disease might progress and what risks are involved. So, to answer the question clearly, yes, chronic bronchitis is a part of COPD. It's one of the main forms of the disease, characterized by long-term mucus production and airway inflammation that lead to airflow problems. Understanding this connection helps in managing symptoms and slowing disease progression.